In my view, I think sexual satisfaction and sexual wellness is critical for the overall general health and wellness of a woman. Very often it's a neglected part of the overall history, physical, and assessment of a woman in terms of her general well-being. And I now know that there's a lot of literature coming out that really supports the fact that sexual wellness, sexual satisfaction really leads to overall general health and wellness as well. We see that there is a wide array of treatments available for men and male sexual health concerns, but unfortunately extraordinarily limited with things that we can offer for women. In my clinical experience, I typically ask all women, no matter what they're coming in for, whether it's a general exam or a specific complaint, I ask them about sexual health concerns because I have the perspective that sexuality is a very important part of overall quality of life and general health and wellness. Well, I think in my clinical experience, I tend to see a lot of women who are suffering from vaginal laxity. And in my perspective, they are having, decreased overall sexual satisfaction. Sex often becomes a chore, and the motivation to have sex is really changing. So overall quality of life, their sexual experience is really decreased. And that really leads to a variety and a constellation of symptoms which have serious impact on the woman and how she feels about herself in terms of her overall sexual self-esteem, how she views herself as a sexual person, and it really affects and can affect the relationship in general. I think it's really important for women to understand in terms of vaginal laxity that they're not alone, that many women are suffering from this condition. My initial perceptions of the VIV procedure is that it's a safe, effective, quick procedure that can be done in under 30 minutes, that is, office-based, that really has excellent results in terms of addressing the concerns of vaginal laxity. So it's really reassuring and really comforting as a healthcare provider who addresses sexual health concerns, specifically vaginal laxity, to know that there is a strong commitment to develop innovative, evidence-based treatments that can help these women who are really suffering in silence. Well, I believe that the best candidate for those who would receive the VIV procedure are those who are really suffering from vaginal laxity. They've experienced changes or decreases in their sexual satisfaction as a result of laxity, or those that may have, sensory changes.